everyone, and thank you for joining me today on the Parent Voice. Excuse me. So our Friday show have a couple of surprises today. Um, everybody's been talking about in Detroit, school is starting back next week. Summer school is an option for kids to actually go back into school buildings. And about 2 weeks ago, I was on a one of the town hall calls for COVID 313 in Detroit, and heard this phenomenal doctor just speaking, and I was like, oh, I have to ask her to come on my show. And so she's going to be our guest today. But before she comes on, what I would love for everybody to do is go and like and share and host watch parties. Anybody who has questions about coronavirus and how the virus actually works or what's going on around school or just whatever. Dr. Fuller is going to answer a lot of those questions today, but I would love for you to share this with more people so that they can ask their questions also. But again, before she comes on, I have a co-host today. I am the Midwest delegate for National Parent Union, and we have this wonderful this wonderful delegate from Puerto Rico, and her name is Soangelis. So she will be joining me today. Soangelis is our co-host, and she's very fluent in both languages. And so welcome, Soangelis. How are you? You're on mute. You're muted. You have to unmute yourself. Yep.
Sorry.
That's okay. That's okay. How are you today?
Good, and you?
I'm good. I'm good. Excited to have you here today with me to help me ask these questions. So tell us a little bit about you and what you do.
Uh, yeah. Thank you for the invitation. And my name is Angelis Rivera. I am the only daughter of my parents. I have three brothers. Um, I'm a mother of two amazing boys, 7 and 8 years old. Um, I'm from Puerto Rico, yes, like Bernita say, and now I am a delegate of Puerto Rico National Parents Union. And here in Puerto Rico, we started working with Puerto Rican Parents Voice. That is an organization that we try to guide and help the parents in the process of involved in all the things that has to be with the education of our kids. And we try to guide the people with needs and like the kids with the special needs that for the government help and everything. So that's a little bit of me. me.
So Angela is being very modest in what she does. She's a fireball in Puerto Rico, and she and I sit on a committee for testing for the National Parent Union, along with a couple other people, Steve and Yahya, and we really had a lot of questions around testing, how we test children and staff and families, before kids return to school. And I'm gonna be honest, like when I first joined the committee, I joined because I was totally against testing. Like I just feel like testing and all this kind of stuff has just gone left so much for Black communities. But one of our partners made me kind of think of it from a historical view about the importance of testing and the importance of our voices being in the planning processes of testing. And if testing needs to happen, what do we need to be doing and what do schools need to be doing? So we were looking for a virus specialist to come on our show, had a couple of people in mind. And then when I heard this wonderful Dr. Bernita Fuller come on to the community, our town hall, I just had to have her on the show. And we had several conversations and she's agreed to come on and kind of come on board and just assist us through this process. So Angelise will be helping me ask questions today, and without any further ado, because I want to give her as much time as possible, I'd love to introduce Dr. Ovita Fuller, and she is from the University of Michigan Medical School, and specializes in research in herpes simplex virus as well as HIV/AIDS. She and her research team discovered the B5 receptor. What that is, I do not know, but it's advancing the understanding of herpes simplex virus and the cells it attacks. So, Dr. Fuller, thank you for being here. Thank you so much.
It is my pleasure, Bernita. Thank you for the invitation.
Yes, yes. So with that being said, I told people the other week you were on the show, so let me lay it down a little bit, y'all. We've had this town hall, and it's just been a wonderful experience for like the last like 3.5, 4 months since COVID happened. Detroit kind of went into a rapid mode of getting information to families, getting information. And Dr. Fuller was on there, and I had just come on, and literally she made a comment, and it just really sparked something with me, like just genuine, and her inference around how we should be approaching education as parents, and from a specialist standpoint, and what she would and wouldn't do if she had young children in school. So I'll stop, and I'll let you go ahead and just tell us more, because I know you have slides available for us today, and I want you to have all the time you need.
Thank you. I just want to say that I've learned a lot about the National Parents Union, and I think it's really a superb organization. I'm really glad that I can connect with you. What happened at the COVID 313 session, just to give the listeners an idea, is I was asked if I would send, what was the recommendation for sending children to summer camps, and would children wear a mask, and did I think that was a good idea? And so I said, well, to be honest, my children are adults and I have no grandchildren, but if I did have young children or grandchildren, I would not send them to summer camp at this point. And I went on to say off the cuff is that if I had that situation, I would probably homeschool my kids this fall. And I realized there were people on the Detroit, the COVID 313 town hall who are part of the Detroit public school system, who are working very hard to set out a plan for return to school. And I appreciate that. And I know that that's needed because not everyone is going to be able to homeschool their children, or want to for various reasons. But anyone who does do so will reduce the number of children that are in the schools and thus keep the density down, which is one piece of keeping COVID from reducing the risk of COVID. So that was the context, and I realized that that might have opened a can of worms for some people, but I appreciate that for you, Bernita, that was something, as you said, something other people were thinking but not saying. So what I'd like to do is simply show 2 slides, and then I'll answer any questions that you guys have. Mm-hmm. So if I can share my screen, which I think I can do. Yes, here we go. So what about school openings? Anybody in this country and many other countries who has children or grandchildren or people they care about would be looking at this question in the midst of the COVID pandemic. And so this conversation is really important, and one that I'm glad that the Parents Network is having. I just wanted to preference what we are doing today with some current statistics. Statistics, by the way, on cases or deaths are always based on what has happened in the past. It takes about 2 weeks before the data collected actually show up in the graphs that we see or the data that we hear from various entities. And so the graph on the left shows you the curve that is actually occurring for the United States. We were talking earlier back in March and April about the need to flatten the curve. And that was by the shut-ins and shelter-ins and stay-homes in order to keep the curve low, below the threshold of where people, where the hospitals and medical schools and medical centers could handle the patients so we wouldn't overwhelm our medical care. So if we kept the curve flat or lower, then we would be able to handle it. In contrast, if the curve went up very steeply, it would overwhelm the medical system and thus also put at jeopardy not only the people dealing with COVID, but the people that also would be dealing with other illnesses. Like, as I mentioned, my mother had diabetes and ended up with a very pneumonia that had to be dealt with. But where could she go if the hospitals were filled with COVID patients? So keeping that curve flattened was one of the driving forces of public health early on. And that's still important. What we see here is with the US, our curve is not flat at all. It went up very high, and this is the total US in all states. And even though some states like Michigan, which is shown here on the right, actually did flatten its curve. So this is the flattening process where it goes down. And we were less than 200 cases reported per day in the middle of June, thanks to very cautious policies instituted by our governor and the team there. In contrast, many other states did not have that flattening process, or when they reopened, particularly after Memorial Day, the numbers have gone up again. And that's what we're seeing here in the national trend. So whereas a nation, we are not doing very well. We have over 3 million reported cases of COVID infection or coronavirus infection, and that doesn't include those that are not reported. So we are in what some might consider a second peak. Some would say we never got out of the first peak, but we're in a place where COVID cases are going up. And all you have to do is look at Texas and Florida and Arizona and other places. And even in Michigan, since the Memorial Day weekend and with many things happening, we're going up. Hopefully this will not go too high before it begins to flatten again. And then the last piece here simply shows that the death rate follows your infection rate. So this is the death rate for Michigan, where you see the curve has gone down, and we're really at almost minimal deaths now because of the practices and the medical care. So I just wanted to put this in context as we consider going back to school in late August and early September, that right now we are not looking so good for what that means for what the cases mean for getting back into school in a safe way. And then the last slide is the CDC government guidelines for what needs to happen in order to safely open schools. And so there's a stepwise process where if you can consider these following, so any administrator or person, superintendent or committee as your committee with the NPU, when you're thinking about these things, ask these questions. Will reopening be consistent with applicable state and local orders? In other words, is that what the state declarations where we are? Is the school ready to protect children and employees at higher risk? Are you able to screen students and employees upon arrival for syndromes and history of exposure? If all the answers are yes and things are in place, then you proceed to the next level. If not, you need to go back and fix those things and not open. If those questions are yes, then are recommended health and safety actions in place to promote hygiene practices, hand washing, cloth face masks, intensified cleaning, disinfectant, ventilation? Is there a plan for social distancing to increase space, to have small groups, to have limited mixing between groups? And I hope we can talk about perhaps some models that might work. Are all employees trained on health and safety protocols? If not, then it's not time to open. One needs to get these things in place to meet the safeguards. Once these are met, then one can go to the third phase, is ongoing monitoring in place. This is realizing that things are not going to stay the same, that this is not a static situation. This is a fluid situation. Just as three weeks ago in Michigan, the numbers were low, today they're going back up. So one needs to be able to monitor the signs and symptoms of what's going on in the community as well as in the local school with students and employees on their daily arrival. Encourage anyone who is sick with a fever or symptoms to stay home or send them home. Plan for students or employees to get sick. There should be a separate space for them to go to be isolated, and there should be a plan for regulating and monitoring the space where they were so other people don't get sick. and other things that need to be done. If the answer to any of these is no, then it's not time to open. So there's a whole line of things that CDC recommends before opening and monitoring schools. And so I just wanted to share that before we got into our discussion. And I'll leave it there for a moment and open it up for whatever questions that we have to talk about today, which I know are a lot.
Yeah, so, wow. So the first slide that you had, in comparison to other states that have opened up,
Yes.
in comparison to those states where Michigan lies now, how quickly did those states like elevate, right? Because Michigan actually opened up way late, you know, like almost a month after other states. So is it a possibility we're going to be where they are in a month?
Michigan is very blessed to have a governor and governments and a health director who are informed and not afraid to make regulations and declarations to help keep people safe versus to please people. All the places are trying to balance, hopefully trying to balance the economy and people's lives and the needs of people. So our government in Michigan has erred on the side of being more cautious, and that's why we see the curve went down, whereas other places opened up restaurants and bars or tourist areas or beaches much earlier because of the demand. And those are the states, if I could show you other graphs, which I didn't put in here, that have lots of COVID cases, and they're shooting this count up here. So Michigan, and what I'm not showing you is that CDC also has regulations and guidelines where if you see yourself going, you may have opened, but if you see the number going up like this, then you can go backwards and shut down things again. You can close out bars and restaurants, or even declare a stay home declaration again. And nobody wants to do that, but that is what is necessary if you see the numbers going up like this. So to answer your question, a lot of other states have very different curves than Michigan. And there are places you can look to get this. Just go to COVID-19 stats, and you'll pull this up.
Okay. Okay. So Angelise, go ahead, take it away. Any questions you have?
Yeah, I have a question for when they collected the blood for the test. Does the government get the DNA or?
Right. I understand. So you're asking about the testing for COVID. So let me talk about that for a minute. There are two kinds of basic tests for looking at COVID, or there's several kinds, but one is to confirm whether someone is positive or not. One is a viral test where there's a swab of the nasal passages, and then that has to be sent off to look for actual viral particles or parts of the virus. And that is not fun, but it actually looks for the virus in the nasal passages and throat and respiratory tract where it would replicate. If it's there, then the test may be positive, but there are some people who don't produce enough virus that when the test is taken, which is just a one-time shot, it's a one-time picture of what's going on, that test may be negative. So if the person is just getting infected or just getting virus and isn't producing enough, it would be negative, but yet the person later on would be positive. Or a person might be getting over COVID or just not producing a lot of virus at that moment and it not be detected. So one kind of test is the viral test that does not require blood. It's a nasal swab. You can also do it with saliva. Those are not as widespread, but there are some places, particularly medical units, that are doing a saliva test where you're also looking for virus. The second type of test is to look for antibodies, and antibodies are part of the immune system's response. Whenever we see something foreign, something that's not us, our amazing immune system will respond in several ways. And one of those ways is producing something called antibodies. These are proteins made by your immune defense system that recognize foreign items. So there you would have antibodies against measles or antibodies against influenza. definitely measles, because everybody gets a measles vaccine. We have no antibodies against COVID-19 or coronavirus because it's a new virus. So when people get infected, they actually make antibodies to coronavirus 2. And those antibodies are what's detected in an antibody test, which is a blood test. You have to draw blood, and the antibodies circulate in the body, in the plasma. So those tests are actually looking for antibody, and they're not very widespread. That's not the kind of test that people do when they're being tested in general for coronavirus infection. There are people that are getting the antibody test because, for several reasons. One, it lets you know if you were infected previously and you made antibodies. Unfortunately, with coronavirus, there's a lot we don't know. For example, we don't know if, like measles, if you get measles, people who got measles who didn't get the vaccine would get over it, and then they would be protected against measles, usually for a lifetime, because they have antibodies and other immune defenses that recognize measles. But with coronavirus, we don't know what happens. The early results from other countries suggest that some people may have a couple of months protection with antibodies. Some people may not even have antibodies that protect them from infection. So really those blood tests are more so being used in research right now to find people who have protective antibodies and using their antibody to help patients who are in the midst of COVID. So the blood tests are really not the typical tests that are done. Most of the schools are going to be looking at people's temperature. As a matter of fact, the CDC, there was a very useful CDC panel in the middle of May called CDC Stakeholders Call Schools and Child Care Programs. And they went through lots of questions. And one of those questions was what kind of testing would be used by school officials to monitor whether children should come to school or not. And the answer that was given is that they were not recommending that testing be done for children because it is just
less likely for them to get it.
Yeah, it's one snapshot. It only tells you what's going on that day, and that the effort to do it is high. There's so many other ways that one could help to reduce risk than trying to test every child. So to answer your question in a long way, the blood tests are not typically going to be what happens. And when that does happen, no, the government does not keep the blood or DNA. It usually goes to a laboratory where it is tested. It may be stored for a bit. Unless someone agrees to do part of a research study, that blood would not be used in any other way.
Okay.
So don't worry about that.
I just asking because in this week I have to do it because one person I was in contact with somebody that has positive, and I have to do the blood test. And I was like, what they were doing with my blood and everything. So
yeah.
That's
and I think a lot of people have had that question when they first said that there's a blood test out there, right? People are like, oh, that's my DNA. Like, I don't want them doing that. You know, people are, for all type of reasons, they just, want to know. But I do have a question about that blood. And then we do have a question also from the online group right here about about the blood. If a person does show that they have the antibody, does the hospital then reach out to them and say, well, we love for you to come in for further testing? Like what does that look like? Or is that still like up in the air and we don't know yet?
Yeah, so let's say that I had COVID and I recovered. And in order to see whether I'm protected or not, and I'm a college professor, so I want to know, am I someone who can go back into the classroom and teach students in person for those few courses which are better in person, or am I better off teaching online because I'm older, right? So I might get an antibody test just to look at that difference. They would draw blood, they would actually look at the antibodies that I have that react with COVID. And they would say, you have a good titer against COVID, meaning you have strong antibodies made against COVID. And then they might do an additional test which says, that test would say, do you just recognize COVID? Do you see it as COVID versus measles versus influenza? So those antibodies could be positive. That test could be positive. The next level of test would be, are the antibodies that are in me protecting me against infection if I see COVID again? So it's the difference between having those that recognize the virus as the virus than those who not only recognize it, but protect against infection or subsequent reproduction of the virus. So that's the next step. And I would be told the results of both of those, because that's going to impact whether I say to the University of Michigan, I can teach in person, or no, I'd be better off teaching remotely because I'm in that susceptible age. And then the third piece is, if my antibodies are protective, that is, they will keep me from being reinfected, at least that's what they look like now. We don't know how long that will last, but I may be asked if I would be willing to donate blood now so they can get some of the antibodies and purify them or pull them out to use with patients who are very sick. And so you would get all that information, you would get that feedback. If you just simply wanted to know if you had antibodies to COVID, you might be told, yes, you do, and that might be it, and you wouldn't be asked anything else.
Okay.
So I hope that helps.
Yeah. I mean, I can see that working in a positive way, right? Like if there's a way to have an antibody that can help other people or even help my family, but you know, we just don't want another Henrietta Lacks process, right?
Correct.
You know, somebody holds on to their DNA and then all this scientific research is going on and nobody's saying anything. But I know you said that there's laws now that protect people. So should people be thoroughly reading what they're signing when they do these tests to make sure there's not some research clause in there? Because every hospital, in my point of view, is not as straightforward as University of Michigan, right? Like University of Michigan saved my life twice. So everybody's not as straightforward.
Well, let me deal with the real question I think I'm hearing. Is we know of examples like the Tuskegee syphilis experiment, the Henrietta Lacks HeLa cells, which were used without her permission. I've used those in my own laboratory before. So when the Tuskegee study was done, I believe it began in the early 1940s and lasted to the 1970s. These men were not told that, one, they had an infectious disease, and two, they were not given medicines when those medicines became available. That now is the basis for human study guidelines, which say that you cannot do that. That is that in other cases where inhumane treatment of humans was done in the name of science have called to be put in place human guidelines now, where every human study has to go through a board of review and be approved for the methods and everything they're going to do before they can do that. So even any other hospital, any other researcher that is doing legitimate research, that is, they're doing it where they want it to be able to report it, then they have to go through what's called the IRB, internal review board, to get approval to do human subjects. So I don't think we have to worry about that. And then even more so, I would encourage people of color and all people, if they are in a situation where they can participate in a clinical study, to do so. And the reason is that if we are not in those studies, then the data that come from those studies may not apply directly to us. An example I give is when heart disease was studied looking at mostly white males, and the symptoms that came up with white males were different than the symptoms that come up with women. And so when women were having a heart attack looking for the symptoms that were described for men, that wasn't what was happening. So women needed to be in the study in order that our symptoms might be included. And so similarly, African Americans and Hispanic Americans and Latina and Latinos need to be in those studies so that our data is included for all kinds of reasons. And so I would encourage people, yes, read the protocol, have somebody with you, have somebody go over it, and that's why I always also advocate that if you go to a doctor or go to medical appointments, go with somebody who can be an advocate for the patient, because the patient is the one who's dealing with a lot. So you want somebody there who can hear what the medical team is telling you, who can help navigate that process. We know there's inequitable treatment in medical care, but if you have people there who can, two people can navigate better than one. So never let a family member go to a medical appointment alone. And if you are asked to be or given the opportunity to be part of a clinical study, review it very carefully and see if it's something that is useful for you.
So I want to get to this question, but from this viewer. So she asked, but I want to go back to the alone part, because people had questions about like what were they doing with patients when they told us we couldn't visit the hospital, and it was our grandparents or our great uncles who were in this hospital alone, and no one was signing off on testing.
Yeah.
So what were they doing then? So I not right now, but I want to get to this person's question first, because they asked it. Do we know how long people are still contagious after the height of symptoms?
Yes, that's a great question. And the answer is, the assumption is that if you are past 7 days without symptoms, then you are not contagious. That's what the assumption, and notice I said assumption, but we're finding that we just don't know with COVID. There are people who have been found shedding virus after those 7 days, or even looking at Ebola. We didn't know a lot about Ebola virus until the West African outbreak, and we found now that people may be spreading virus, particularly in semen and vaginal fluids, particularly semen, up to 6 months after they've recovered. But we did not know because there were not enough people to study this. So yes, the average is about 7 days is what we think, but we don't know for sure if that's hard and fast.
Yeah. Wow.
Unfortunately, there's a lot with COVID that we don't know, or coronavirus, which is why opening schools is such an issue, because as my husband's university team has said, it's like trying to nail Jello to the wall, right? You're trying to do one thing, but you're trying to do it in a changing, fluid circumstance, whereas what you're planning today may not be the policy or the action that's right for the environment that you're in 3 weeks. So yes, we don't know how long, but that's about the estimate.
And we're talking about opening up school for summer school, literally Monday, the 13th, right? Summer school options where kids can go into buildings, and the teachers are even upset about it because they're like, we're not prepared. We are not prepared. But the conversation is, well, parents have to go to work, and we don't want the summer learning loss to be so, or really COVID learning loss, because it's beyond summer at this point. But we're trying to be ahead of these kids getting back in school. And so Angelique, so when are your schools opening?
The teachers and the administration will start in August 3rd. They don't say anything yet for the kids, but the daycares and preschool, they are already open. Yeah, I'm a pre-K teacher, and my center is closed because the administration say no, we are not ready for the kids, because how will we keeping the kids with the mask? How will we keeping the kids that don't give you a hug? Because in
Social
here,
distancing, yeah.
Yeah, how are we keeping the kids that don't go with the other friends and play and learn together? So she decided that close the preschool for everything is come back to the good things without COVID, or they have some vaccine or something like that, because now it's so hard for us to keep the kids in a distance and wear the mask. I say I can't wear my mask all day, so how the kids were doing the same, breathe the same air in this closed area, so it's too much for us.
Yeah.
So just a comment about this. Actually, I have a cousin who shared with me that she's been doing daycare for 29 years, and they never closed. This is in North Carolina. And but she went through the procedures that they do every day, that they take six-month-old to 5-year-olds, and they are washing hands all day. The parents check the student in, the temperature is taken. They have procedures that they do like clockwork. The children learn this, and she says it's really centered around keeping everything, hands washing very, very frequently, uh, sanitizing tables. When the kids, they're just strict rules and regulations, and the young kids grow up or are in that environment. They don't know any different, these young kids. It's the middle schoolers and junior high school and senior high school students and college students who know the previous pre-COVID ways that will be even more difficult to adapt to what's necessary to keep people safe or to reduce risk. I don't think we can keep them safe. What we can do is multiple layers to reduce risk. Those include screening people, self-screening before they come to school, so nobody that has symptoms is sick. It includes distancing, making sure there's distance between students. It includes things like having lunches in the classroom or possibly staggering when people come. You've heard models where you might have one group of kids come the first couple of days of the week and another group of kids come the second day. Well, a suggestion is not just make that a couple of days, make it 2 weeks for a group of kids, then they have 2 weeks homeschooled or online school, then you have them come back the next 2 weeks. Keep the same teachers, right? Such that one of the problems with COVID is when you get different households mixing or different groups of people mixing, then you end up bringing to a new group that take it away to their families. And it may not be the kids that are in jeopardy, because fortunately what we're seeing around the world is that children are at less of a risk for severe COVID. They may get infected and be asymptomatic or have minor symptoms. And there are some syndromes with children, but they're rare. But the issue is they are vectors where they take that virus back to their families. And if there are any susceptible adults, which could be parents or grandparents or others in the home with underlying conditions, then the virus gets to those people who can not only reproduce virus, which keeps it high in the environment, but also exposes it to people who could have severe COVID symptoms, illness, and possibly die. So that's the issue. Young children are easier to follow the rules because whatever rules you tell them, once you explain it in love and consistently, and so Angelise, you probably know this working with the young group, they are much more compliant than older kids who are, in middle school and junior high and high school, because, they're going to want to hold hands with their friends. They're going to want to get together in their groups, even if they're not in the same group, quote, for the classroom instruction. So that's going to be a much more difficult behavior to deal with.
Wow, that's kind of the flip of what I was thinking. I literally thought the little ones, because you have to let them guide everything in early childhood education, and then letting them guide everything. Like they want to go and hug their friends and play in the sandbox with the friends and stuff like that. But the older kids would be more, I thought it was the other way around. But so your sister has been open the whole entire time, and she said no cases.
My cousin's daycare has been open the whole time, and they've had minimal cases. They've not had to close down because of COVID, but she says they've been doing this for 20 some years, and their infection rate is very low because they're very consistent with the routine they put the kids in, the routine they have the staff in. They're disinfecting, they're washing hands, they're taking care of toys. Students come in, or kids come in learning this. And so they're very, very fortunate and diligent in what they do. And I agree with you. Younger kids are also going to want to hug their friends, but older kids want to do that, and they will figure out ways to do it, even to go against the rules and guidelines. Whereas the younger kids will usually try to adhere if they really understand.
Yeah,
We're dealing with human behavior. Even adults are like this. I mean, I, for one, for example, when my mother passed, I wanted to celebrate her life the way that I knew she wanted it to be celebrated. And we got permission to have the service in the church with 50 people or less because the guidelines in North Carolina said that was okay. They had just been changed. And so we were really jubilant about that. And then I realized, oh my goodness, I'm inviting people immediate members of the family, from my cousins, but I don't know that they are safe. I
Yeah.
don't know
Yeah.
that it's okay. So wait a minute. Although I want to honor my mother, we have to do this safely. So we sent an email to say, if you either need to have been isolated, you need to get tested, and you need to quarantine until this time in order to accept this invitation to come to the service. If you can't do this, please don't come. And so what I'm saying is human nature wants to do what we're used to doing. And the time of COVID says that we have to really think about safety for ourselves and those we love, in which is counter sometimes to what we really want to do or what we do just from our innate reflex action. And that's why it's so hard. People want to go to beaches because it's summertime. And I personally think that's very selfish, because it's like, if that's what you do and that starts the infection going again, because the virus is not an evil thing, it's simply looking for someone to reproduce him.
Yeah.
Don't give it that opportunity, because if you give it that opportunity, fulfilling what you want to do, then you're causing a problem for many others who might have been safely at home and barbecuing in their backyard as opposed to going down to the beach or going to the bar. So this is requiring that we think of others. As someone says, love your neighbor as yourself. And that's not what we're used to doing as people. That's why America, I think personally, is having the most difficult time, besides national leadership, having a very difficult time dealing with COVID, because we're used to doing what we want to do.
Yeah. And I keep telling people, like, America is arrogant in this. It's showing our arrogance, right? It is really showing our arrogance that we know best. Like, we're not taking the effort to learn from other countries and their experience, because they shut down before us, and then some of them are shutting stuff right back down. Like, we're not taking that effort to learn that, but that's a whole nother long conversation that I'm sure you will come back with us to have. But before we close out, I did want to talk a little bit about the two things really quick. The distance in schools, because we've seen these plans. So I really like that plan you said about the 14 days off, 14 days on, right? Because then that actually gives you time to look at what's happening in your own home. So if a child goes home and they're sick, and then that parent, we would hope, be honest to say, hey, some kind of way along this 14 days, my child got sick, so he may not be returning. And then that whole classroom can have a look at what's going on to see if it came from the class or not, right?
Right.
But then we're seeing these models, though, where there's 4 desks. There's like a square. There's a desk here, desk there, desk there. So kids are facing one another, but they have these shields up. But the reality is it's still not social distancing, because a child they're going to touch the next child. Like, if their pencil falls, they're going to be prone to, reach over and pick up the pencil, and then you've touched somebody's chair, whatever, right? And some people are like, oh, it's not that serious. It's not that serious. But is it that serious?
Well, Bernita, I know that the educators and administrators are looking at many, many options. And I have to say that I don't know what's best. Because what we're dealing with is a respiratory virus, meaning that it is in respiratory drops and airborne. Wearing mask and correctly wearing mask is absolutely critical for those who are old enough, and that's people 2 years older, 2 years and older, as well as people who have no underlying asthma or other respiratory illnesses. We just need to get used to that, and we need to wear them over our nose and our mouth. So parents can help by finding masks that kids really like, and teaching them that this is part of helping keep everybody safe. Another feature of most children is that they do really want to please people. If you explain to them what is going on and why they have to do it that way, they won't always be perfect, because there's some spontaneity, but at least I think they try. I mean, we saw this when campaigns were made for kids' safety in using seatbelts in cars. When they were taught the right thing and why it's the right thing and that it saves lives, they were the one telling their parents, Mom, put on your seatbelt. Dad, you don't have your seatbelt on. So what I'm saying is, I'm not equipped to give you to lay out how this can best be done. What we do know is that coronavirus is airborne and respiratory droplet borne, such that a mask will keep anyone who is producing virus from spreading that virus into the environment. Now, it's also keeping you from breathing in virus from outside, but it's mainly to keep your own particles within you, which means there's less in the air in the environment. And so number one is people need to wear masks and wash their hands often and be aware of trying to keep away from people, at least 6 feet if possible. How the desk can be arranged, at the University of Michigan, what's happening is smaller classes will be meeting where people can space out in rooms. Larger classes will actually be online because there's just no room big enough for 65 students or 100 students to space out in and be that far apart from each other. And wearing the mask correctly and keeping them on when you're close, when you're in contact with someone is important. So yes, there are a lot of things to consider, and that's why I said, honestly, from my heart, if I had young children at this point, I would work with my relatives or my neighbors or my friends or people I trusted to try my best to homeschool them. And or if the school system has a program that seems feasible, you know, like 2 weeks there and 2 weeks online, or whatever the program is that seems reasonable, I would be prepared. I know a lot of parents have to leave home to go to work. So opening schools is really important for that, as well as really critical so our kids don't get so far behind in their learning and socializing, which is part of learning as well. So there's a lot of things we could talk about. I do encourage people to go to the site for the CDC stakeholder call, schools and childcare programs. It's filled with useful information that at least gives you a starting place. It's a CDC site, and go and listen to that. It's about a 45-minute audio that you can listen to, and at least tells you what the issues are and what's being recommended. And then, of course, talk with your local officials, be at the meetings where this is being discussed. Talk to your children, let them know what's being considered. It's not an easy task. In my opinion, I would say that state legislatures and other political leaders need to look at priorities. Anytime we reopen things, there's a risk. So when we reopen restaurants where people can actually go and do takeout versus reopening them so people can go and sit in the restaurant. To me, sitting in a restaurant is not an essential thing. It's not anywhere near having children educated or having children be able to get their education. So we have both of those things that are risky. And yes, opening the restaurant and the bar affects people's jobs. But in the long run, if we minimize the risk with the bar and restaurant by not maybe opening them fully, maybe have takeout, but not sit down, and put that energy into our children's education, in the long run, we will be better off. So that to me would be the higher priority. If I had to say which thing to do, I'd say carefully reopen schools if the circumstances fit the CDC guidelines that have been put out there. Monitoring, having a plan, having a system of keeping people minimizing risk. And then as those things are in place, then we can look at where we are. If we can keep the cases low, then the next phase is necessary. But if we can't keep the cases low and we see them going up, then we've got to do those things that minimize risk and reduce the cases and do those things in a consistent way until the cases go back down, and continue doing those things even as we might open up one thing, and then if that's good, open up another, and if that's good, open up another. That's the process until there is a vaccine for coronavirus.
Well, whew, thank you.
It's not simple.
I will ask, this is not simple, and this is not like a one-off conversation, right? So I thank you that you have agreed to be along this journey with us as we ask questions, and as our communities reach out with questions. We want to have nothing we don't want to answer them because we're not who you are, right? We haven't done all this research. And I thank you for coming on the show. I really do. I thank you for the next shows that you'll come on. And how can people reach out to you personally?
My email address, I had it on the first slide. If I can show,
Yeah.
it's fullerao@umich.edu. And uh, there it is here.
Yeah.
And if questions are sent to the National Parents Union, I will be happy to help. And there are others that can do this as well, but I just believe that we have to work together. I'm so pleased that you are who you are as a community organization of parents who are seeking to do the best for your children and to make your voice heard. After all, education actually starts at home. We tend to often say the school system's going to do this. It's like, no, the first responsibility is in the home. So I'm so pleased to work with you in this effort.
Thank you so much. And thank you, So Angelise, for co-hosting with me. And I'm sure you'll come back the next time Dr. Fuller is on. And forgive us for going over today, you guys. But of course, you know this conversation is well overdue and needed. The richness of it is something that we can take back to our own families and say, I heard from a viral specialist, forgive me if I'm saying that title wrong, but I heard that this is like from University of Michigan. Who can get better than that? I'm not being funny, but they've saved my life twice, literally saved my life twice. And I'm honored to be in this room with her in this space. So thank you. Please go and share. Please add comments or questions, any questions you have. She will answer even later on. And this has been the Apparent Voice. Please watch our other shows that'll be on today and the rest of the week, or this is the last day. But tonight, Marisol is on, and we look forward to talking to you next week. Thank you, and we're signing off. Have a wonderful day. Okay, thank you guys. Thank you so much. That was